Hi, everybody. Thanks for joining me for today's webinar to learn more about PRMI's new Personal Health Assistance Program, why we're doing it, and how you can support this effort along with your leadership team. This should only take about 15 minutes or less. I really want to be mindful of your time because I know you're all super busy. So my name is Gabrielle Yoder, and I'm a personal health assistant at Catalyst. I'm also the ND on staff, and I'm really excited to be working with you and the PRMI team because I'm really passionate about health and well-being. My personal goal is to help as many of your employees as possible to reach their health goals by the end of next year or sooner. And thankfully, that also lines up with Catalyst goals for your company as well. So it works both ways. Now, you should have received some stuff already from your leadership team, things like emails and a video overview of the Personal Health Assistance Program. So you probably already have a general idea of what I'm going to be talking to you about today. Before we really get to the meat of our webinar, though, I wanted to tell you a little bit more about our company. This is Daryl. Back in 2003, our founder started his very first employee wellness program while working for a small company in Oregon. He didn't really have any experience back then, so he did what most employers still do today. He kind of chucked stuff at the wall to see what sticks. And unfortunately, improving employee health wasn't a major focus in 2003. The big buzzword back then was to kind of improve company culture, which is really good, but at this point it wasn't enough. In 2008, our founder's very dear friend and his colleague, Daryl, passed away at age 38 due to heart failure. If the wellness program that our founder had made was better designed around health improvement initiatives, he felt that Daryl would still be with us today. Daryl acted as the catalyst that sparked the idea for our company, Catalyst. And our mission is to help employers never lose another employee because of a preventable health condition. It also is why our name is spelled a little funny. The D in Catalyst is in remembrance of Daryl, and it serves as a reminder of why we do what we do for companies just like yours. So I know that most of you probably have some experience navigating the kind of murky world of health care or health insurance. Most of us have kind of experienced frustration when using health insurance on a personal level, and a lot of us have also seen that the healthcare model we've inherited isn't really ideal. From the plan design to the actual health systems, each segment kind of remains siloed and separated in an armor of red tape or bureaucracy sometimes. And navigating the insurance can be kind of confusing for most people. And a lot of the care plans focus on symptoms instead of looking for the reason those symptoms exist. And those are known as root causes. And that's why, with your help, Catalyst is hoping to lead the way in changing the approach to both health and to care. When it comes to relating to healthcare at the workplace, there's a lot of ways to make accessing care easier, making the costs lower, and improving the overall health and well-being. We do this at the employer level, and our goal is to have healthcare providers take a more proactive, outbound approach instead of waiting for the patients to come to them. This is really the key role of our PHAs, and PHA is Personal Health Assistant. They reach out to who might need a little bit more guidance or support. And we also look at your company's medical claims data differently. We leverage the predictive analytics so we can forecast future cost trends and savings opportunities. And we can also identify employees that have health risks for early interventions. The idea here is to prevent a risk from becoming a worse or more expensive or just even a chronic health condition. So that's good for your employees as well as your bottom line. And instead of just looking at the typical clinical indicators that make each person a kind of flat black and white page of numbers, we really try to help the whole person. We look at the clinical stuff too, because it's very important, but we also help with lifestyle factors that sometimes health providers just don't have time to help with. And that's what we're here for. And as I discussed previously, we try not to focus on the symptoms as much. We take a different approach. We look for the whys. Why is this happening to this person? Why is this person ill? What is causing this symptom? And then we work together with their doctor or healthcare provider to kind of try to bring them into really good health. And that's our ultimate goal. This lowers the healthcare costs for the employee and for the company. And happy, healthy employees are more productive, and good moods radiate to change a company culture from within for the better. So it's a good win for everybody. Finally, we really need to treat the employees like customers, which means we need to connect with them in the ways that they need the help. And if that's for them to better understand how to use their medical benefits, or how to help them find a new doctor, or even discuss health improvement ideas with them, we can do that. So we're closing in on the finish line. If you can just bear with me for a few more minutes. I really want to make sure that you know and understand what drives most healthcare costs. Now, as you can see from this slide, there's 8 sort of core bad habits, all kind of lifestyle related, that fuels about 80% of healthcare costs in the US, including for your company and every other company. Poor diet, poor sleep, and stress are probably the ones I see most often in office workers. And these are kind of an easy fix on paper, but in the real world, they're a little more difficult. Catalyst is going to provide you and management some tools to help your teams overcome these 8 bad habits. We recognize, though, that employers are responsible for leading the way and being good stewards of their employees' health and happiness. So if you implement even just a few of our suggestions over the next few months, we think that you can radically reduce the cost of the health insurance for your company. And that's in turn going to affect your premiums as well. We really want to prevent premium increases and maybe even get your premiums to drop over the next few years. And that's exactly why your company partnered with Catalyst. Now, this new health assistance program, it's all about providing employees with free individualized support by our in-house care team. Those are known as PHAs, or personal health assistants, which I think I mentioned before. We've assembled this team of college-educated, highly experienced people who specialize in health-related fields, like naturopaths like myself, nurses, fitness instructors, masters of nutrition, just to name a few. And another great thing is that it's completely confidential. We are legally bound by HIPAA laws not to disclose any information that members share with us to anyone, not your employer or even your insurance company. It's completely confidential. And this program is available to all current PRMI employees who are on Cigna's medical plan. So you can reach out to us by phone or by email for any reason. Doctor's referral, if you need to connect to preventative care, help with managing a chronic condition. A lot of people are not sure how to start a new diet, and maybe they need nutrition or meal planning advice. If you need to make an appointment or to discuss alternatives to medication with someone like me, I'm an ND. We can help you with that. And some employees might actually be getting a call from us, like myself or another PHA on my team. And if we do that, it's only going to be because we noticed from the medical claims that Cigna's given us that maybe that person hasn't completed their annual appointments yet, or they don't have a regular doctor, or they have a serious chronic condition and they need a reminder to follow up with their physician. I also wanted to follow up on something that I told you earlier. If you remember, I said that we will help you make those positive changes in your office. We're actually going to be distributing tailored health content on a monthly basis on specific health topics to employees, and we're emailing pertinent health information only to those who need it. Our goal is to kind of be the first thing that employees think about. So we also need you to help us spread the word to your teams as well. The good news is that we have a lot of templates that we've created just for you. So emails, flyers, videos, a lot of these, they'll come right to your inbox. You can just click forward and send them on. And we've tried to make it as easy as possible for you to just get the information out there. Also, it's really important. We really need you to schedule a webinar for your employees. Their buy-in for this is even more critical than yours, and it's going to give them the chance to get to know us better and understand what kind of things that we can do for them. And it's really great if you can attend those with your team, because this is your program as much as it is theirs. So keep your eye on your inbox for those communication templates. They're coming in pretty soon. Now, before you get back to work, this is the last slide, we're done, I promise. But before you get back to work, I really wanted to take another moment to talk about Daryl and any of the Daryls that you might have in your life or in your office. This isn't about blaming or shaming anyone. I'm not asking you to go harass someone in your office, because maybe they have an eating disorder, or they smoke or drink, a lot, and maybe, think, oh, this person, they're making our health premiums go up. It's not about that. It's kind of about recognizing that we all have our faults, and we all have people in our lives that we'd like to see get better. Not just because of the bottom line, but because we care as human beings. Responsibility, our founder said, is the ability to respond. It's true. We all have a social responsibility to each other, but most especially to those in positions of authority. We're required to set a good example. And I hope that I've been able to make this presentation at least a little bit enjoyable. And I'm really glad that you all joined me today. And any questions you have after this session, just shoot us a quick email and we'll get back to you as soon as possible. It's usually within 1 or 2 business days. But if it's something very urgent, you can always give us a call at the number listed on the screen. Thank you very much for your valuable time. I hope everyone has a very happy and productive remainder of their day.